I'm Kati Kleber, author of 5 books, the host of the Fresh RN podcast, and author of the Fresh RN blog. Today we're going to talk about some well-being tips for nurses. To me, being a nurse means being a good communicator, but also being a completer. That nurse is the person who gets everything done, right? The nurse is just a home base for so many people. That connection between, healthcare happening and healthcare doing. A lot of people have very emotional or profound experiences going into the profession. Not me. But I did have a passion for education and a deep interest in the medical field. So one of the things that I thought about was, okay, who's in the medical field but does a lot of teaching, and nursing kind of fit the bill pretty perfectly and ended up being one of the best decisions of my life. To me, well-being boils down to 2 things: having healthy boundaries and being very intentional with your time. Taking care of yourself really boils down to making sure you're getting good sleep, being intentional with your time, getting some alone time, also seeking help when you need it, and making sure that you're doing the things that you love. So the FlexPath format really helped me prioritize my own well-being because I could hold it in healthy balance with the rest of my life. I was really able to engage in meaningful learning without stretching myself too thin. Somebody messaged me, they sent me an email. My first book was, it has a gray cover with a nurse hat on it, and she said that the book was so inspiring and so helpful to her that she thought it was just this little gray rectangle of hope. And that just made me feel so great, because that's exactly why I wrote it, was to be there in those very vulnerable moments to provide support and encouragement and hope.